this video, we're going to look at the unique features of the nitrous oxide. So before we start, we are going to ask some questions, and these answers can be hidden in the video. So first question we want to ask is, what is the concentration effect? The second question is, what is the diffusion hypoxia? This is commonly known as the Fink's effect. The third question will be, what are the places where the nitrous oxide is contraindicated? So you'll find all these answers in this video and you'll learn a lot more in this video. Begin with, first we are looking at the concentration effect. So what is this concentration effect? So what we need to know is that the blood gas partition, the coefficient. So blood gas partition coefficient, it is about 35 times, it is 35 times higher than that of the oxygen and the nitrogen. So here what happens is its rapid uptake. So there is the rapid uptake. It diminishes the rapid uptake. It diminishes its volume. It diminishes the volume and the concentrates volume, and it concentrates the remaining anesthetics. It concentrates the remaining anesthetics, and this is in the alveoli. The next, moving ahead, next we look at the second gas effect. So what is meant by the second gas effect? So the second gas effect, it means that there is a concentration effect. So there's a concentration effect of one gas, over the another, and this is known as the second gas effect. Then increase, we need to know that an increase in the partial pressure of the second gas. So the increase in the partial pressure of the second gas, that is the oxygen and volatile agents. The oxygen and the volatile agents, due to the rapid uptake of the rapid uptake of the nitrous oxide during induction. Next, we move on to the diffusion hypoxia. So what is meant by the diffusion hypoxia? It is also known as the Fink's effect. So we'll be looking that. So under the Fink's effect, first we need to know that there is the rapid elimination. So what is meant by the rapid elimination? So there is a rapid elimination of the nitrous oxide, and this is during the recovery, and it causes a reduction in the partial pressure of the oxygen, and it leads to the hypoxia. Then what we need to know is it is avoided by 100% oxygen. It is avoided by 100% oxygen, and this is for the 10 minutes during the recovery from the anesthesia. So now we move on to the nitrous oxide in gas filled spaces. So nitrous oxide in gas filled spaces. So what does this mean? So here it diffuses into the the air containing cavities. The cavity, air containing cavities, and it is more rapid. It is more rapid than the air. More rapid than air. So air, what we mean is nitrogen, and it can be absorbed by the bloodstream and absorbed by the bloodstream. Next, we look at another point, that is if the walls surrounding the cavity are rigid. If walls is surrounding cavity, so in case they become rigid, the pressure rises instead of the volume. So the pressure rises instead of the volume. So now we are looking at some interesting, that is a nitrous oxide, where it is contraindicated. So if you look at this, the contraindication, there is the venous. There is venous or the arterial air embolism. Next, there is also the acute, in case of acute intestinal obstruction. So what are the other contraindications? Also in cases of the pneumo, syphilis, and the pneumothorax. Next, even in cases of the pulmonary air cyst. Then the intraocular air bubbles. Also the tympanic membrane grafting. So now we will look at answering our questions. So first we asked 3 questions, we are going to answer it. The first question we asked is about the concentration effect. So the concentration effect, first we need to know that the blood gas partition coefficient. So this partition coefficient, it is 35 times as that of, higher than the oxygen and the nitrogen. And because of this, there is rapid uptake. Hence, there is rapid uptake. So this rapid uptake, it diminishes the volume and the concentrate, and it concentrates the remaining anesthetics in the alveolus. So it concentrates the remaining anesthetics in the alveolus. The second question is, we asked about what is the diffusion effect. So what is the diffusion hypoxia? This is nothing but the Fink's effect. So under this, we need to know that there is a rapid elimination. There is rapid elimination, and this is of the nitrous oxide during the recovery. And this causes the reduction. This causes a reduction in the partial pressure of the oxygen, and this leads to the hypoxia. This is one. Next, we also need to know that there is it is avoided by using the 100% oxygen for 10 minutes. So 100% oxygen used for 10 minutes during the recovery of the anesthesia. The third question we asked was the nitrous oxide. So where is it contraindicated? So this nitrous oxide, it is contraindicated in cases of there is venous and the arterial air embolism. Next, also in case of the acute intestinal obstruction. Then also in cases of the pneumosyphilis and the pneumothorax. Next, we also have in cases of the pulmonary air cyst, also the intraocular air bubbles. Lastly, there is also the tympanic membrane grafting. So in such cases, the nitrous oxide is contraindicated. Now we are going to look at some bonus questions. So you can answer these questions in the comments. So the first question we want to ask is, what is meant by the second gas effect? The second question, so here we just have to ask two questions. So the nitrous oxide, talk about nitrous oxide in case of the gas filled spaces. So how does it act in such conditions? So you can answer these questions in the comments.